Hello, everyone. We'll get started soon. We're just going to give everyone enough time to join us from the waiting room, and then we'll get started. Awesome. Well, hello, everyone, and welcome to the Addressing Social Determinants of Health and Dementia Risk Resources for Public Health Agencies webinar. During this summer Social Determinants of Health webinar series, the Center of Excellence on Dementia Risk Reduction has been finalizing resources to support the implementation of this important work in dementia risk reduction. So I'll start by introducing myself. Hi, everyone. I'm Michael Lewis. I am the Associate Director for the Center of Excellence on Dementia Risk Reduction, and I'll turn it over to my colleague.
And hi, everyone. My name's Chelsea Klein. I'm the Senior Associate Director of Health Policy at the Alzheimer's Association. Thanks so much for being here with us today.
I would like to highlight that for today's webinar, it is being recorded and it will be shared during our recap to our registrants. Any use of recording devices or AI assistance is not allowed, and we will have to remove those devices from this webinar. So now to get into today's agenda, I will go over the housekeeping items, provide an overview of the Center of Excellence on Dementia Risk Reduction. We'll then go into the social determinants of health resources, and then hopefully by the end of today's webinar, we'll have about 5 or so minutes to go into questions and answers. So again, for today's housekeeping items, today's webinar is hosted by the Alzheimer's Association Public Health Center of Excellence on Dementia Risk Reduction through a funding cooperative agreement with CDC. Today's webinar is recorded, and we will be sending that out in the summary email as well as with any resources that are being discussed today. If you would like to use closed captioning, you can do so at the bottom of your screen. You should see CC at the bottom, but if not, there's 3 dots to your right, and you can click on that and find the closed captioning option. And then lastly, please feel free to put any questions that you have in the Q&A box, and someone from the public health team will respond. And if we don't respond, we'll get to it during the Q&A session. So for the center overview, we focus on reviewing the latest scientific evidence from researchers. We then take that opportunity to then translate that latest evidence into actionable tools, materials, and messages that you'll see on today's webinar, as well as we then make sure to assist state, local, territorial, and tribal public health agencies with putting the dementia risk reduction work into practice. And now I'll turn it over to Chelsea.
Thanks so much, Michael. Next slide. Great. So like Michael said, one of the big areas of emphasis for this is kind of translating that science on the modifiable risk factors of dementia into actionable tools that public health agencies can use to address dementia risk reduction efforts in their community. In about 2022, the center kind of refocused efforts to really look at what are the social determinants of health associated with dementia risk. So as a kind of first step in doing this, our partners at Wake Forest University School of Medicine helped us convene an expert roundtable of researchers who have expertise in the fields of social determinants of health related to dementia risk. And as a part of this, we then held a social determinants of health workshop at the 2022 Alzheimer's Association International Conference, or AAIC. During this workshop, we had our expert researchers come to talk about what is that evidence base, what does the science look like, to tell us about what are those associations between social determinants of health and dementia risk. Along with those researchers, we also invited many public health officials to come to that conference and that workshop to really hear about what are those steps that public health agencies can take to address those dementia-related SDOH. So the first resource that we'd like to highlight is a summary of that workshop. So it is available on our website now, and it provides an overview of the science, what those researchers talked about at the workshop, as well as what those strategies and actions that were discussed with public health officials that they could then do to address those dementia-related SDOH in their communities. Alongside that, and based on the overviews of research that our expert researchers conducted on the dementia-related SDOH, we also developed a series of short summaries that provided an overview on the current state of evidence on various social determinants of health related to dementia. You can see them listed there. So we have short 1 to 2 pager summaries on economics, education, environment, food insecurity, and racism, discrimination, and inequities. So these really do a kind of a deeper dive into what that science looks like and what is the evidence base. So for each of these summaries, there are a few key sections. We have what is already known about that topic. What does the background and evidence base look like for those social determinants of health as potential risk factors for dementia? What are the implications of public health? And a discussion of kind of what this means more broadly. So those are also all available on our website and are really great resources to get a better understanding of what the science looks like. And these also kind of pair nicely with a series of summaries that we developed and disseminated earlier in the Bold Center, which focused on some of the other key modifiable risk factors for dementia, including cardiovascular health, diabetes, obesity, et cetera. And I'll pass it over to Mikkel to go over our summer SDOH webinar series.
Great. So for our social determinants of health webinar series, you can view this playlist on our Alzheimer's Association Public Health YouTube channel, as well as during this series, we get to hear from academic research experts, just linking the relationship between social determinants of health as well as dementia risk reduction, as well as we were able to hear from state and local health departments about how they were able to integrate dementia risk reduction into the work that they are already doing. And I did want to point out that some of the things that we discussed throughout the webinar series is just highlighting economic stability, nutrition and food security, social engagement and isolation, and healthier environments, and how not only this work is linked to our own social determinants of health, but how it can also assist in improving brain health. And now I'll pass it back over to Chelsea.
Great, thanks so much. So the next set of resources were recently released, and these are our series of SDOH infographics. So again, these pull on a lot of the science that I discussed during kind of that science summary resource, but we put it into a nice kind of easily digestible infographic format. So these infographics showcase information on the social determinants of health related to dementia risk, and also describe strategies that public health can take to address these issues. So we have a set of 5 different infographics covering economic stability, healthy environment, nutrition, foods, quality education, and social connections. So you can see on the right, there's an example of our healthy environment infographic, but Mikkel, if you want to go to the next slide, I have some bigger versions of the infographics for you all to see. So here are 2 of our infographics, one on nutritious foods and one on social connections. So you can see for each of these, we give kind of very high level information about the topic generally, and also what does that link to dementia risk look like? And then we also have specific strategies or actions that other communities have taken in the past to address those SDOH in their own communities. So really great kind of quick reference guides to get an overview of the science, as well as potential actions that your community can take to address those social determinants of health related to dementia in your own community. And these infographics are also co-branded with CDC, and again, available on our risk reduction website.
Awesome. Thank you so much, Chelsea. I appreciate it. So next, what I'm going to show is the social determinants of health animation video. In this video, we were able to produce this just based off of the social determinants of health webinar series. So we're really excited for you all to be the first to see this animation video. And we'll also make sure that this is available on our website, and we'll drop that link in the chat as well. And as a reminder, please be sure if you have any questions throughout this webinar to use the Q&A box once we get to the Q&A session.
The environments in which we live, work, learn, and play have a profound impact on our health throughout our lifetime, including the impact on our brain health and our risk of developing Alzheimer's and dementia. These are known as social determinants of health. When a community works to ensure its residents have access to education, medical care, economic stability, adequate housing, and safe spaces to exercise and socialize, it can reduce the risk of chronic diseases such as diabetes, heart disease, and cancer for all people living in that community. This includes cognitive decline and dementia. Communities by changing systems and structures that help reduce health disparities. Our ability to live a healthy life relies to a great extent on the community surrounding us. And these supportive environments can help not only achieve better physical health, but optimal brain health as well. By addressing social determinants of health, communities may help reduce the risk of dementia across the life course and reduce health disparities for the entire population. Here are some examples. Increasing access to quality education protects against cognitive decline and dementia. Access to quality healthcare ensures all aspects of brain health are addressed. Neighborhoods with sidewalks and green spaces allow for physical activity and social engagement, promoting overall brain health. Frequent, meaningful social connections may lower the risk of cognitive decline. Promoting economic stability throughout a community can These social determinants of health are wide-reaching, affecting all facets of health, even when they don't seem directly related to dementia. Public health can accelerate actions to promote brain health, helping communities address the risk of cognitive decline and dementia. Partnerships and coalitions that address the social determinants of health help everyone live life with the healthiest brain possible.
Awesome. How great was that animation video? I'm so excited that we were able to create this animation, and we do hope that you're able to use this not only in your community, but also at community events. And now I'll turn it over to Chelsea.
Great, thanks so much, Mikkel. I totally agree that video is awesome and great to see kind of a visualization of the broad impact of SDOH, especially as it relates to brain health. So like Mikkel said, hope that you share that across your communities. So the last resource and the latest resource that we're super excited to share with you all is our very new and to be released very shortly Social Determinants of Health Toolkit. So this toolkit is really a culmination of so much of the work that the center has done over the past 4+ years, as well as a culmination of so many of the other resources that we just spoke about. So this toolkit provides a step-by-step guide for public health agencies to help identify the dementia-related social determinants of health that are affecting their communities, and to also kind of facilitate how do we find partners? How do we implement actions to address those risk factors? So it's a really, we hope, helpful guide for you all. The toolkit is structured around 4 key steps. However, before we get to the steps, I did want to share that the toolkit does start off with a summary of those key social determinants of health, related to dementia risks, so a bit about the science behind those SDOH. So that includes educational quality, economic stability, food security, safe and healthy environment, and social connection. So kind of those same SDOH that you've seen referred to throughout the resources of this webinar. And then it goes into those 4 key steps. So those key steps are identification of need, partnership mapping, program and asset analysis, and implementation and evaluation. And I will kind of walk through what each of those steps looks like in the next few slides. So next slide, please. All right, so first, I know this might be a little bit small, but the first step is identification of need. So what this really focuses around is helping public health departments identify what are those priority and most pressing areas of need in your community that you could then kind of choose to prioritize and act on. And so within this step, we have provided a few different resources that can help public health agencies in identifying what are those key dementia-related SDOH that are right for public health action in your community. So we have listed a few free population level SDOH data resources that are clickable in the toolkit, and you can access to kind of figure out from a population level, what are those needs of your community. We also understand that some communities might be more interested in what social needs look like at the individual level. So we also have linked a few SDOH and social needs screener tools, like the Prepare tool, that help you get kind of a layer deeper to understand what are those individual levels look or individual needs look like in your community. And then from kind of these different data and tools, our hope is that you would then be able to figure out what is that prioritized area of action, that prioritized SDOH that you would like to focus on. Next slide, please. All right, so once you've had that prioritized area of action, let's say it's increasing accessibility and consumption of nutritious foods, then this next step really focuses on partnership mapping. So you have your area of priority. What are the different partners that can help you in addressing that need and advancing efforts around that? So I think one thing that's really important to this section is a kind of a shift of the mindset. So a lot of the time when folks think of Alzheimer's and dementia, they think of it as more of an aging issue, but we know it is a broad public health issue and can really affect folks and can be affected across the whole life course. So being sure that when you're looking at advancing efforts related to social determinants of health, that you're involving and engaging a wide variety of players. So we do have this kind of helpful tool here that allows you to list out who are some key partners in your community that can help you reach your objective, who are the main contact people, what is their area of impact in the community, what's their level of influence in the community, and what could their potential role be in helping you to address that dementia-related SDOH. Next slide, please. Okay, so next slide, or the next step is step 3, program and asset analysis. So you have your prioritized kind of identified need, you have your partners mapped out. Now it's time to understand what are the different programs, resources, interventions that are available in your community to help you address that need. This process not only kind of helps you to think about what are the programs that are already going on in your community to help address social determinants of health, but also can help you identify what are the different gaps and opportunities where a newly formed intervention or program might be able to help. One tool that we found to be super helpful is NACCHO's Community Health Improvement Matrix. So this matrix, which you can see in the box below on the left, allows you to kind of map out the different programs and assets in your community by prevention level as well as intervention level. So this really helps you get a kind of comprehensive view of what are those different programs in the community, as well as where are those gaps and where could new interventions help to address that SDOH. Along with this, we also provided some different evidence-based interventions and programs that help address the various dementia-related SDOH that we pulled from the CDC's community guide, as well as Healthy People 2030, just to provide some examples and kind of get your wheels turning about what could be implemented in your own community. Next slide. And then step 4 is implementation and evaluation. So you've identified your need, mapped out your partners, understood what are the programs or interventions that could be implemented to address that need. And now it's time to implement and evaluate. And kind of step before that is really identifying what are those key outcomes that you'd like to be measuring during your implementation and evaluation. We've listed a number of those in the toolkit as examples. We also have this kind of helpful action planning guide, which allows you to map out what is the intervention, what are some of those key action items that you should take, who is the lead in your community that will help make this happen, who are some of those partners that you should be engaging with, what are potential barriers that will need to be overcome in implementing this intervention. What does your timeline look like, those key deadlines, and then what are your evaluation metrics? Within this step, we also provide helpful information on what are some of the key considerations you should be thinking about when evaluating your program. What are different modes of evaluation, be it surveys, focus groups, other community engagement ideas to really make sure that you're fully evaluating the intervention and kind of refining it as you go. So those are the kind of key 4 steps of the toolkit. However, we also do have a really helpful appendix section. I don't have any screenshots of that, but this appendix includes a case study, which is a kind of real world example of how a community has implemented an intervention to address a social determinant of health in their community, and we've structured around those 4 steps of the. We also have fillable versions of all of the different tables that you've seen throughout kind of this walkthrough. We also have a really comprehensive list of other available social determinants of health data resources that you can pull from or access in order to get a better understanding of SDOH in your community. And then we also have links to other helpful resources from the Alzheimer's Association and other partners. And then finally, I'll mention that we do have a evaluation QR code on the last page of the toolkit. We would really appreciate once you use the toolkit, we would love to hear your feedback and how it's been implemented in your community.
Thank you, Chelsea, for that walkthrough of the SDOH Toolkit. And I would like to also highlight that in partnership with creating the Social Determinants of Health animation video, we also partnered with our Healthy Brain Initiative team to really promote this animation, as well as if you do utilize it, please send us an email. We'd love to hear how you were able to use it. But now, with the little bit of time we do have left on this webinar, I want to go ahead and jump into Q&A. Kat or Shelby, could you let me know what questions we have in the chat?
Yes, we did have some great questions come in. So the first one is for Chelsea. Who did you partner with when putting the social determinants of health resources together?
Yeah, that's a great question. So we worked with a lot of really great partners in doing this. The first of which I had mentioned earlier, when we were pulling from, the different scientific summaries to really get an understanding of what the evidence base looked like, we partnered closely with Wake Forest University School of Medicine and understanding what that science looks like. We also worked internally with our diversity, equity, inclusion team at the Alzheimer's Association to ensure that the information that we were providing was inclusive and culturally relevant. And then we also worked with our partners at NACCHO and ASTO to help us in a review and kind of brainstorming for the toolkit and making sure that it was relevant for a public health audience.
Great, thank you. And Mikkel, this question is for you. How has the Center of Excellence worked with health departments to implement dementia risk reduction strategies?
Oh, that's such a great question. I would like to highlight that we do have two programs. One is the community convening, where we went into 6 local communities and met with, well, partnered with the local health department, and then they invited community partners to these meetings. And it was a 2-day meeting where we talked about the modifiable risk factors and social determinants of health and how that dementia risk reduction messaging can be implemented into the local health department's work. And from there, we were able to expand that program to the Risk Reduction Learning Collaborative, where now nationwide we are hosting 7 meetings. Um, and we're inviting up to 10 health departments as well as their local chapter staff person and just training them on the community convening framework, as well as offering any technical assistance or resources that they might need. So definitely sign up for our newsletter for future programs like that.
Great. Thank you so much. If you have any additional questions, we have just a minute or two left, so please put those in the Q&A. And we have answered a few questions in the Q&A itself, so feel free to check those out if you had other questions they might have previously been answered regarding the toolkit.
And Chelsea or Shelby, I do see a question and it's asking about what about older adults when it comes to risk reduction and starting early in the Alzheimer's journey? Wasn't sure if you would like to highlight on that.
Yeah, I can start with answering that question. I think, like I mentioned, there are interventions regarding the different modifiable risk factors for dementia that can be implemented across the whole life course. Once a person is diagnosed with Alzheimer's and dementia at an older age, I think a lot of those key activities, like maintaining a healthy diet, keeping up with physical activity, other things that keep your brain and your heart healthy, are really integral to well-being. So I'd say definitely things that should be continued, even if a person, and especially if a person is diagnosed with Alzheimer's or dementia.
Thank you both so much for answering the questions. I see that we are running a little low on time. So Mikkel, if you have other slides you would like to share.
I know everyone, it's a 30-minute webinar. We kept it short this time, but hopefully I just want to say thank you all again for joining us, as well as thank you for Chelsea and Kat for assisting on this webinar today. This webinar is part of many programs coming out of the Bold Public Health Center of Excellence on Dementia Risk Reduction. So we do have the QR code for our e-news just to stay connected on our new resources, as well as you can find a lot of these resources on the alz.org/risk reduction page. A reminder that the Social Determinants of Health Toolkit is not yet on the website, and hopefully by next week we'll have that launch. But again, we'll also notify that launch on our e-news. So please take a second to register. And then lastly, as you're exiting today's webinar, there is a feedback form that we would like to ask, and we appreciate 2 to 3 minutes of your time to just let us know how this webinar went, as well as today's presentation, and if there are any future resources you would like to see coming out of the Center on Dementia Risk Reduction. And we hope you enjoyed today's webinar, and I hope you have a wonderful rest of your day, and please take care.